Hi, I am Dr. Adil Karnul, consultant neurosurgeon in Malland Lifeline Hospital. I am working here since almost 1 year, as this hospital was established since that time. So I have taken this topic as a head injury because it's a very sensitive topic. It needs lot of knowledge of common people should know about this, and also awareness should be there in between common people and as well as in the people who is dealing with the health sectors in the health sector departments and all the things. So the head injury is a very serious topic because as head injury itself has a rate of mortality of 65 to 70% because of the impact of the injury, compact of the injuries, and because of the roads what we have, because of the standards what we are maintaining in our helmets. Because of there are so many reasons, we are not able to make that impact as it should be done. To reduce down these head injuries, we should have usage of proper helmets, usage of proper road traffic rules, and everything should be maintained as per the guidelines from the road traffic police department. Coming to the incidence of the head injuries are almost 25% because of the RDS, and in which 65 to 70% is the mortality. It shows that high rate of death is there in this one. So if we divide that, head injuries are like mild, moderate, and severe. In mild, it is like patient will have small, little symptoms. In moderate, patient have little more symptoms. In severe, it is patient is unconscious or semi-conscious. Patient is not able to talk, or you can see the direct bleeds. So now we directly jump up to the serious conditions, very severe head injuries. What you should do as a common people, what you should do as a medical fraternity. Any patient who is coming to you, or you have seen the patient on the roadside, if there is an accident, what you are supposed to do as a common man is like immediately clear the ways, and make the patient, make the person comfortable, and call for the assistance ambulance immediately, and simultaneously you try to give a good stoppage to the bleeding by giving the compression. Okay, one thing. And second thing, in brain, if brain is outside the skull, so in that very rarest of the rare, the patient will be surviving. But try to stop the bleeding and give the elevation of the head, and airway should be clear. All these small things should be taken as a priority, and immediately ambulance help and should be shifted to the nearest center for the further treatment of the patient. This happens in the head injury. And as we doctors, we do the CT scan depending upon the severity of the head injury, brain injury. Depending upon that severity, we further take a plan for surgical, non-surgical. Non-surgical, what is the outcome? Surgical, what is the outcome? So in surgical, we have 2 to 3 types of injuries, which a common man should understand. There is the brain is covered with one layer. Above the layer, there is a one bleed that is called extradural. Beneath the layer, there is one bleed that is called subdural. And inside the brain, there is a contusion. This all three require may require, may not require surgeries depending upon the criteria. We have to plan for that one. This is about the head injury in brief. Now coming to what is the a common question people asked us, like what, sir, when we should do the CT scan, when we should do the admission of the patient. So the small thing about this is whenever any fall you have seen, at that time you are supposed to see any person, especially coming to the pediatric age group, any babies who has fallen down should not have any external injury, should not have ear bleed, should not have any other feeds or weakness or excessive crying or vomiting. If these symptoms appears, immediately rush to the nearest center and get your CT scan done and get admitted at least for 24 hours of observation. If any if CT scan is showing any kind of bleed or any injuries, then neurosurgeon will treat according to that one. That is the protocol what is recommended by it. For the adult patients, any head injuries, if mild, moderate, severe, then immediately rush to the nearest hospital, take the assessment of a neurosurgeon, and then according to that, according to the GCS of the patient, a neurosurgeon decides whether to go with the CT scan or not. If GCS is low, then immediately CT scan will be done. If GCS is less, if there is no signs like vomiting or weakness, disturbances, or excessive sleep or unconsciousness, if these symptoms are there, then we immediately go with the CT scan. Otherwise, we can wait for 24 hours, 12 to 24 hours, then we can plan for CT scan. But admission is recommended for this kind of patients if even one symptom is also present. Otherwise, it is like we can wait and watch for it. This is the recommendations, what we are supposed to do it for this. Now coming to the precautions, what are the precautions we have to take? For the pediatric age group, definitely the head injury happens in the home. As a parents, we are supposed to take care of the children in utmost as a priority. And at the school, we should have the playgrounds in a proper setup, and they should also advise for the helmets during the play, playing football, rugby or volleyball, basketball. At that time, they are supposed to wear the head caps and the helmets. And same thing, person who is riding the bike should be above 18 years to 21 years as recommended by the road traffic officers. As per the police department, that protocol should be followed, helmet should be wear, and they should strictly follow the rules of the traffic as per the law. Thank you very much.